Pregnant women here in Georgia face more challenges than other women across the country, and many more women die here during pregnancy or preterm delivery than almost any other state.
And live at 5, researchers think they have a solution, and Atlanta News First reporter Abby Casores looks at their work.
Two Georgia Tech researchers say that their published paper is a roadmap to improving maternal outcomes here in Georgia. Right now, hospitals are struggling. Federally funded maternal care units are closing, leaving patients across our state without access to appropriate care.
Once a hospital closes, it's pretty much over.
According to the Georgia Hospital Association, 12 hospitals in both rural and metro areas have closed since 2013. A report from healthcare firm Chartis says 18 or more are at risk of joining them.
Our work really adds to the conversation by highlighting regions that access is kind of hanging on by a thread.
This map shows maternal care deserts in the state. Roughly a third of Georgia counties have no OBGYNs, and fewer women have access to elevated help called critical care obstetrics. The area between Macon, Albany, and Savannah is dismal. Women in rural areas often have pre-existing conditions and need better access to specialized care. Georgia Tech researchers Lauren Steinley and Megan Meredith say a more thoughtful approach that targets specific needs in each community could turn the numbers around.
High-risk women in Georgia, we have a pretty high maternal mortality rate compared to other states. So it's important that we're really taking care of our high-risk women. So understanding which areas might lack higher levels of care and making sure that we're providing resources to those specific areas.
They found expanding 16 existing hospitals would make the most difference. They also say it's important to have incentives in place for people to work in rural spots of our state. In Atlanta, I'm Abby Casores.